Tourette syndrome is a neurological disorder. The Neurological Alliance describes a neurological condition as any condition that affects the brain, spinal cord and/or nerves. Because these systems control your mind and body, neurological conditions can affect the way you think and feel and interact with the world. Neurological conditions can affect anyone at any age. Further down the page, the website places Tourette syndrome in the stable with changing needs type. Tics aren't always Tourette. Tourette isn't the only tic disorder. In fact, the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, describes 3 tic disorders depending on frequency and severity: provisional tic disorder, persistent tic disorder, and finally Tourette's disorder. Tics vary. Tics aren't just swearing. In fact, that isn't the case for most people. The NHS lists examples of how tics can manifest, adding that tics can be associated with stress, anxiety, tiredness, excitement, or happiness. The National Institute of Neurological Disorders and Stroke describe different kinds of tics. Simple tics are sudden, brief, repetitive movements that involve a few muscle groups. They are more common than complex tics. Simple tics often precede complex tics. It then goes on to describe simple motor and vocal tics, and then complex motor and vocal tics. The difference between these kinds of tics we can go through in a later video. Tics aren't the only issue. I've learned over the years that Tourette comes with all sorts of challenges, from trouble sleeping, to lack of concentration, to bullying. This article from the Tourette Association of America talks about Tourette being more than just tics. There's even a section dedicated to the common difficulties students experience with Tourette syndrome. It affects everything, from education to social life to a career. Age of onset. The NHS states that tics tend to appear in childhood between the ages of 2 and 14, with 6 being the average. Going back to the DSM-5, a Tourette's diagnosis requires tic onset before 18 years of age. Most people show signs of tics early in childhood, however some people are experiencing their first tics in adulthood. This is something we will have to come back to in a later video. As always, thank you so much for watching, and please subscribe for more.